A clinical trial at Mercy Hospital St. Louis is giving qualifying heart failure patients an option. It's an investigational device designed to stimulate particular cells in the arteries of the neck to signal the heart, kidneys, and blood vessels, improving heart function.
Yes. Nancy, how are you doing?
I'm doing great.
Nancy Evans is very active, doing almost anything she wants with her family and friends. She recently got her energy back after suffering from heart failure for so long. Years ago, she was told she wouldn't live another 2 years. Proving them wrong, Nancy got help at Mercy Hospital St. Louis. Cardiologists prescribed medication. She has a heart defibrillator, but it wasn't enough. Not for the life she wanted.
I was mostly afraid that I would drop dead any minute. My thinking was like, I can't do this because I'm not well enough to do it.
Things like getting behind the wheel of a car concerned her. After all, heart failure is a condition where the heart cannot pump enough blood to meet the body's needs. Patients struggle every day with fatigue, shortness of breath, and swelling in the legs and ankles. But then Nancy was approached with an idea that changed her life.
Okay, well, let's do it.
Mercy Hospital St. Louis is one of the top 5 centers in the country offering a clinical trial for this investigational device called BAROSTIM NEO. The device stimulates special cells in the arteries of the neck called baroreceptors in order to signal the heart, kidneys, and blood vessels that may improve heart function and reduce heart failure symptoms.
It actually stimulates receptors in the arteries that carry the blood out of the heart. It interferes by triggering a response from the brain to modulate that response, and the brain sends those signals down through nerves to different target organs. It lowers the blood pressure, so your heart is pumping against lower pressure, so it's consuming less energy. It slows the heart down, so it's not working as fast. That also reduces the amount of energy the heart needs. At the same time, tells the kidneys to not retain salt and water, so the heart is not facing increasing amounts of blood that it has to pump to different organs.
He says patients experience improvements in quality of life, breathing, energy, and an increase in stamina.
Maybe 3 weeks, 4 weeks, I noticed a difference already. I wasn't out of breath. I could stand in front of the mirror and put my makeup on without getting out of breath.
And here's how.
This is what we call the carotid body, which is that area that has those pressure receptors, and the nerves that connect to the brain are abundant in that area. It's sort of a fancy pad that sits on that area or lives there. You actually suture it down to the body of the artery, and then we extend that wire all the way across the neck tissue to the upper area of the chest, which is essentially an electric device. There's probably millions of electric circuits and a very, very powerful battery in there. Essentially a brain or a control unit.
So I decided to go for it.
Go for it, she did. And now that seems to be her motto for anything she wants to do.
It was Christmas. I decided that I would make fudge and I would cook some stuff. Before I would kind of like, oh, I don't know if I can do that or not. I did what I wanted to do.
Years after hearing that she wouldn't be around today, deep in her heart, she says she knows the truth.
God was not finished with me yet. He has me here for a reason. And whatever that reason is, I don't know. Maybe it's just to love my kids and my grandkids and my great-grandkids.
For that reason, Nancy is here now to say,
don't be afraid.
For Innovations, I'm Kathleen Berger.